So, hi, my dear Neet PG aspirants. This is Khanduja. So, students, in the given session, we would talk about the Rural Service Bond of Karnataka after PG. Okay, it has a 50 lakhs penalty and it is applicable for both government and private seats. So, do watch this session till the end if you are applying in Karnataka Neet PG Counseling 2025. Okay, so as you all know that in Karnataka, there are lots of private medical colleges and options are available for students that want a low fees college and also for the students that have a rank above 1 lakh 20, 1 lakh 30,000. Okay, so that means are lots of candidates applying in Karnataka and their brochure of 2025 states that rural service bond will be implemented to all the category of students whether they have taken admission in government, private, team, under government quota, management quota, or even if NRI quota. Now, private quota and management quota are two different things. Private is actually very less expensive, and management becomes a 1 crore at 1.35 crore per annum types of seats. Okay, so even if you have taken a clinical seats whose budget was around 3 crore, still you have to submit this annexure consisting the rural service bond. Okay, and if you have done your MBBS from Karnataka and already served this rural service bond, then you do not have to do this. It is only for students that are doing first time medical education in Karnataka. They haven't done any previous service bond. They would be requested to submit a 1 year compulsory service bond, which includes doing service in government hospital in urban area. Even though its name is rural service bond, they are mentioning it as an urban area. Okay, and in most of the cases for private medical college students, it is not implemented. Worst case scenario like COVID happens after your graduation, then maybe government would ask you to do some services, but they do not have the budget in most cases. So for private medical students and management quota and D medical college students, you would be allowed to leave this service bond after your graduation. Okay, they won't be asking your services if you are a private medical college or the medical college students, but you have to submit this during your admission process. This was for private quota candidates. But if you are under government seat, okay, all India or even if through state counseling, then this rural service bond can go up till 3 years for you. Minimum it is 1 year, but it could go to 3 years also. That is mentioned in the Karnataka. So in most cases, 1 year is asked from you, but they can also ask 3 years if you are provided a government seats in medical colleges of Karnataka. Okay, so for all the types of students, for all category of students applying in Karnataka, you have to submit a service bond. For private colleges and deemed medical colleges, it is 1 year. While if you have gotten a seat through government quota, all India quota seat or state counseling seat, then they can ask for a minimum 3 years also. Okay, so there are two annexure 1, annexure 2. It is available on the Karnataka PG counseling website. Okay, and remember in most cases for private seats it is not implemented. Okay, because it requires lots of budget at the government end. They cannot provide the jobs for all the candidates of private medical colleges now. So in most cases it becomes null and void. Okay, so if you want a session regarding Karnataka Neet PG counseling, Uttar Pradesh or D Medical College counseling, okay, you can text me on the above WhatsApp number. We can have a discussion. The session is around 40 to 45 minutes. You can discuss a maximum of 2 clinical branch in a single session. You can know what are your possibilities, what type of budget you would see if you're looking for radio diagnosis after 70,000 rank. Your rank is 25,000. You just need general medicine under 75 lakh total budget where it is possible. Either is it possible in Uttar Pradesh or in Karnataka? What are Karnataka resign rules if we leave the seat after round second? These things can be discussed in that single session, which needs to be booked by texting on the above WhatsApp. And you can join my Telegram for all the updates regarding Karnataka, Uttar Pradesh team. I do only for clinical seats, private medical colleges. Okay, and you can join my Instagram also, Khanduja1430. All the best. This rural service bond PDF is available on the Karnataka PG counseling website, and I would also upload this on my Telegram channel, Khanduja, Manas Khanduja 1430. Okay, bye bye. Have a nice day.